My husband Bill and I, we've been together for over 23 years. When I met him, he came with an adorable little girl, Ashley. She was 2 at the time.
I was doing rock climbing out at Kangaroo Point, and Carolyn was a flight attendant working for Ansett. She happened to be up on an overnight trip and came along with her sister.
Yes, that's where we met, at rock climbing, and Bill was in the army and he was a sniper and also did bomb disposals. So it was a pretty adventurous match.
In 2003, we were ecstatic to find out that we were having a bub.
I was actually 8 days overdue when, and it was the night before our planned induced labour that I went into natural labour. He placed her on my lap and said, "It's a girl." And he asked me, had we chosen a name yet? And I said, yes, it's Madeline.
Over the next 7 weeks, we went to the paediatrician several times, voicing our concerns of Madeline. She wasn't feeding well, she wasn't sleeping well, she was crying all the time.
Started to see some involuntary flickering within Madeline's eyes. It seemed to go in a bit of an arc from left to right and only at certain occasions. So we rushed straight back to the paediatrician and asked him to have a look. Unfortunately, he kept talking to Bill and I and missing when Madeline did the flickering with her eyes. And Bill got his attention by saying, if there is something wrong with our daughter, either you fix her or I'll fix you.
Yeah. At the time, we were only getting 40-minute blocks of sleep.
Exactly.
It was just taking its toll on us.
But it worked, and within 2 hours we were in the Royal Brisbane Hospital once again seeing our neurologist. The next few weeks were incredibly tough. After many tests and medication trials and trying to establish feeding regimes, we were given the most devastating news that any parent would ever want to receive, and that was on the future capabilities of our daughter and her life expectancy.
Madeline had quite a few different diagnoses that contributed to her condition. She had
severe refractory epilepsy, meaning that the medication couldn't control her seizures very well.
She had a central hypertonic cerebral palsy. She was floppy rather than stiff.
She also had cortical vision
and nutritional deficiency,
requiring to be fed through a gastrostomy button. This was through the use of a pump and at a very low speed.
Most of her feed, some of that also related to the form of cerebral palsy that she had. Over time, she also, with those nutritional deficiencies, she developed some osteopenia, so she developed brittle bones.
Later on developed chronic lung disease as part of her condition.
Because of the aspirations that she had, and over time she also had episodes of neutropenia, some of them related to the medications that we had to use for her.
At the time, we were given 12 months for Madeline to live. Our lives changed and our new lives begin.
Yeah, we utilised and lived within the hospital system for over 12 years, and we attended many specialist appointments throughout that time. They included endocrinology, neurology, respiratory, gastroenterology, the Cerebral Palsy Health Clinic.
Dentist.
Yes, the dental clinic, as well as many other allied health services. Caboolture Hospital became our first port of call for Madeline with her reoccurring chest infections and pneumonia. We were rewarded with great paediatricians while we were there, and our final one was exceptional, Dr. Lisa Kane.
The Caboolture Hospital Children's Ward became quite a familiar place for us. The staff were almost part of our extended family.
So to have a good relationship with the families, it's really important that we understand, or at least believe what they're saying. Like, sometimes you find when some patients first arrive, sometimes it's hard to, for them to explain exactly what's going on. But as you get to know the families, you know exactly, how to communicate with them. They know how to communicate with us, and you tend to be able to pick up on those little things that they say that either they're not coping or that they need some extra assistance, and they seem to be, as they get to know us, they find it easier to communicate with us as well. So we're all learning together.
Madeline's conditions were sometimes challenging, but so was the health system and some of the specialists too. But we never gave up. Our goal was to provide the very best care that we could for our daughter. All of these experiences and diagnosis did not define the beautiful, boisterous, vibrant princess that was our girl Madeline.
Immaculately dressed, hair was always beautifully braided. She had the longest plait actually.
She was very clever, smart and very social.
Very cheeky.
Very cheeky. She enjoyed music and singing, and she would sing duets with whomever she could coerce into singing with her.
Loved her animals.
The outfits that she wore were really, beautifully coordinated, and she, was obviously very loved and well looked after.
We treasured every day with our princess.
Yeah, we were very lucky.
At the age of 12, Madeline contracted pneumonia. It was a recurring event due to her chronic lung disease. The next 22 hours really didn't go to plan.
No.
We were informed many hours late into the night that Caboolture was unable to provide the care for our end-of-life plan because they didn't have the paediatric equipment available, and it looked like they wanted to transfer us to Lady Cilento Hospital. Our shining light came in the form of Mosh, the head of ED that night. He was very diligent, kept us informed, and he was the first person to come and ask us as a family what we wanted for Madeline. We said we were concerned about the transfer to Lady Cilento Hospital and that we prefer to be here at Caboolture in a familiar environment and around the professional, friendly people that we knew.
Yeah, the staff sort of knew our needs.
And we had organised that plan. We were still not sure what was happening.
Whether we were going or staying or going, no one could give us a clear answer.
And the nurses everyone was exhausted and frustrated. The nurses were getting really upset for us. They even said, you should be screaming or yelling at us, getting really upset. But I said we had to remain calm for our princess at this time. I said she needed her parents to know that she was there and that she was going to be all right. So the manager from ICU, Hamish, came to visit and he spoke with Mosh, heard our story. He offered to take care of Madeline at Redcliffe Hospital. She passed away 3 days later on the 9th of May at 5:15 p.m.
The day after Mother's Day.
Our final conversation in ICU was conducted by the ICU doctor and with the social worker, and Bill and myself were in a private small room, told us that her little body was just too tired.
And she wasn't outputting her carbon monoxide levels?
No, and that she was dying. So she told us the first thing we had to do was go and cuddle our girl and hold her tight. I didn't hear anything else past that point. Obviously just clicked into the mother carer mode once more because our job wasn't over yet.
No.
And we had to provide the final care for our girl.
We didn't want to give up at the end because we put so much into it from day one.
Absolutely. Several months after Madeline's passing, Bill and I went to the Caboolture Hospital Children's Ward to thank all the staff and the nurses for their care and support. It was there that Dr. Lisa Kane, Madeline's paediatrician, encouraged me to use my experience and knowledge to help other families. But with her support, I joined the Caring Together consumer network at Caboolture.
I actually met Carolyn about 3 years ago. We were doing some surveys with family members and patients for our new paediatric strategy, and at that point I'd spoken to about 30 different families, and then I came into the children's ward at Caboolture, and Carolyn's daughter Madeline was here on a visit, and Most of the interviews I'd done with people had taken about 10 minutes, and Carolyn and I got to talking, and it was about an hour and 15 minutes before I left. You meet with a lot of people, and you talk with patients and families, and for a lot of them, they haven't had a lot of experience in the health, in the health sector or in hospitals. It might be their first or second experience. And then you talk to someone who, this has been their entire world for 12 years, I think it was at that point. And they can talk so clearly and succinctly about their experience. They're not saying it's all roses, they're not saying it's all terrible, they're just being really factual and like, this is honestly my experience, and this is what's good, and this is what hasn't been good, and this is what you could change. And I remember I actually was writing on the iPad, and I ended up just stopping. And I was like, let's just talk. I need to hear all of this. It was about a year after that that I got a call from Dr. Lisa Kane, and she said, hey, I've got someone you should talk to, because we had the consumer network up and running then, and she said, I've got this great person that you should speak with. I think she'd be really great. And I said, what's her name? She said, Carolyn Wharton. And I said, yeah, I remember Carolyn.
She's just so articulate and so well organised, and she'd done such a wonderful job for her daughter. I felt that this was something that she would be ideally suited for, would be taking on a consumer advocacy role.
Well, I actually also suggested that Caroline would be a great consumer, because I just feel that, for one, there was a few issues that we had with Madeline at the end of her passing that we could have done better. And so I wanted to make sure that I had a consumer's point of view, and because Caroline was so open and we'd, had worked with her for so long, I just thought she would have been the most appropriate person for us to have.
We had a chat, and I know that first conversation was, it was really interesting, because I know Carolyn said to me, I don't know what I have to offer. I don't know what I can possibly do here. And I said, all you have to do is be yourself, and it will be really powerful.
When Caroline first came to our paediatric service improvement group, it was a little bit of a, oh, what are we allowed to say, what aren't we allowed to say?
She processes information well, and she's somebody who is outside the hospital system in some respects looking in. She's seen the good and the bad of our hospital systems, and she's always been very good at articulating well where we could potentially improve things.
And since she's actually come on board, she's been fantastic. So she's very easy to talk to. It makes you feel more humble when you are discussing patients, because also as there's a consumer in your meeting, and so you also feel as if you're helping the patients, because there's a consumer there that's also listening to what you're doing and making sure you're staying on track with everything.
All of us are patient focused, but our perception of what that means, sometimes we need that outside voice to help guide us as to what that actually means.
So Caroline has been really instrumental in putting our orientation video together. And she's actually helped us look through some of the pamphlets that we give out to parents to make sure that they are appropriate. And she's also, as we walk into our unit, she's actually helped to re-sign our entrance, just to make sure that it's more consumer friendly, so people know exactly how to get into our unit. So she's been a great help.
Carolyn's actually involved in our medical education each year. Right at the beginning of the year, we do doctor orientation. We do 3 sessions over 3 weeks, and we've used Carolyn's actual experiences and created an hour-long session on patient and family-centred care. We have a particular session on clinical handover, which is based on one of the experiences that Carolyn had. And she's part of that. We do a simulation, and she's part of that. And then our medical officers are able to ask her questions, and they're able to pull apart what happened, whether it worked, whether it didn't, and what they would do differently.
So I enjoy working with Caroline. I just think that she is fantastic. She's always thinking about, the patients and the families, and because she's got that experience, she knows exactly what they're going through. And so I think it's a great asset for our unit to have someone that is also so passionate, but also keeps us in line and because we've known her for so long, we have this great communication. So I feel that I would be able to tell her anything, and then I would hope that she would be able to do the same for me.
It's been very, very easy, and I think that's, if you've got a woman here who is very, very suited to that role, and I think that's part of it, is that she makes it easy to work with her, and she's now part of our team. And I think that's, where we've gained. Her loss has actually been our gain.
This journey has empowered me. It's given me somewhere to channel my energies and my passions, but most of all, it's created a legacy for my princess, Madeline.